CI650.
Let a smile be your umbrella on a rainy day. And if your sweetie cries, just tell her that a smile will always pay. Whenever skies are gray, don't worry or fret. A smile will bring the sunshine and you never get wet. So let a smile be your umbrella. Be your big umbrella on a rainy day.
Ladies and gentlemen, the Dr. Ron Zokel Singers, and Let a Smile Be Your Umbrella. If you let a smile be your umbrella in the winter in British Columbia, you're going to get pretty wet.
And cold.
Holy jumping Jehoshaphat. What's your telephone number at the office? I know it. Do you know what the number is?
604-872-0222.
Of course he knows what the number is. Yes, 604-872-0222 is the local office in Vancouver, 604-872-0222. And in Coquitlam, the telephone number is 604-936-8244, 604-936-8244. I guess people don't have to feel embarrassed to call that number, whatever the reason is.
I hope not.
No.
If you're looking for is to answer a question or two, feel free. Give us a call.
It's that simple.
See if we can do it. We might even be able to do it over the phone. Who knows?
No. Possibly.
You might. The ladies at the desk are very, very knowledgeable.
Really?
They're very experienced.
Oh.
And they'll ask you a bunch of questions about your issues and what's going on, because they'll help them channel the work that needs to be done, and particularly the amount of time that we need to have a sit and chat. And we'll put as much as an hour together for you.
That's interesting, because it's not like the TV repairman who says, no, I got to take it down to the shop. So bring your teeth down to the shop and we'll have a look. But there might be something there that one of the ladies could help you with the phone with. That's interesting.
Oh, they might.
Yeah.
And if your problem is something that they know for sure we can't help you with, but we have colleagues that we know can, then we may just channel you right to the right place right from there.
So you have connections with doctors and physicians and other dentists all over the world.
Over the world, different fields, whatever it might be. So if you have a concern, let us help you. We'll do that.
What's one of your most difficult cases you've ever had?
Oh, people who are diabetic and smokers. And surgically, that's a very, very big challenge. Now, you do that, and somebody has a very, very heavy bite and a lot of periodontal disease. Now, that's one of your largest challenges any dentist is going to have. And always should be referred to a specialist, somebody who has a strong understanding of both the medical end of things as well as the dental end of things, how to do surgery and how to do prosthodontics. Those are the very biggest of challenges.
It's interesting that you brought up smoking. Let's say, because we know they have a lot of baby boomers that listen to this program, and of course a lot of baby boomers still smoke. What happens if somebody used to smoke and they haven't smoked for 15 years? I guess as soon as you quit is a better thing, right?
Well, absolutely. As soon as you quit is a better thing. But if you've been clean 56 or 15 years from smoking, then you're pretty darn healthy. That's no longer going to be an issue for you.
Interesting.
Yeah. In fact, they say if you quit for 6 months, you've cleaned out the majority of your lung, and your addiction's long gone, and you're already significantly better off. Just a 6-month period.
So that's going to make things better for me when I come to see you.
Oh, hugely. So we have people who are smokers that need a bunch of work done, and if it's surgical, and we will tell people all the time, if you're smoking 2 weeks in front to 2 weeks behind the appointment, we don't want you touching a cigarette, because that will really put the risk in for complications on your surgery. And I don't care who you are or what's going on. If you're a smoker, then that will complicate the surgery. Doesn't mean we can't get it done. It just won't be as good as we would like it to be.
So 2 weeks before a procedure, 2 weeks after must be the longest month in a smoker's life.
Well, in some cases it's a challenge. But what I was going to add on to that comment is that we've had a lot of people, much more you can ever imagine, who have chosen to quit after being off cigarettes that long, because the physiological addiction factor in smoking is resolved within 2 weeks. So if you haven't had a cigarette for 2 weeks, then what's left is a psychological addiction. And that's much harder to get rid of. But the physiological addiction, the physical chemical structure of how your body responds to the lack of nicotine if you stop smoking, is going to take about 2 weeks to resolve.
Yeah, I guess I quit smoking about 15, 16 years ago. And I remember it comes lunchtime. After lunch, of course, you want the coffee and a cigarette, right? So there's no cigarette. So I came to this radio station to do an afternoon show on a Sunday. And one of the guys says, "Hey, Luke, can I bum a cigarette off you?" I looked at him. I said, "If I had one, I'd give you one." He says, "What'd you do, quit or something?" I said, "Yeah, I did."
Yeah, cool.
Yeah.
And they say that cigarette smoking is some of the toughest addictions to resolve and to get away from. My parents both did it cold turkey.
Really?
3 packs a day. One day just stopped, and they never went back to it, which is great.
I can remember the old days you could actually sit there and smoke in the dentist chair. Yeah, you're probably not that
Well,
old.
the dentist is probably smoking too.
Well, that's true. Something a lot stronger than you.
I was giving a training program in Italy. I was in Genoa, Italy. We're teaching a bunch of the dentists there how to do some refined gold work. And this is going back into the, we're in the 80s, about the mid 80s. And they're all physicians, all the dentists who came out of Italy at this, it was a specialty of medicine. So they became physicians first. And I remember that these guys were all smoking while treating the patients as we observed them. And I really had a problem with this because I was looking at this and I said, you're some of the best trained people in understanding the physiology of medicine and all the illnesses and such, and you choose to smoke. And it blew me away. So when they say that knowledge or education has nothing to do with resolving addiction, that's absolutely the case. I think people have to want to quit before they do. And these guys, obviously, at this time, there were these physicians that were smoking. There were dentist physicians. They don't want to quit. They may be very knowledgeable. They understand the problem. They understand the ramifications of not quitting, but they choose not to do it.
I think you're right. I think with some people, like they show those pictures of teeth of the cigarette packages. When I was a smoker, that did nothing for me. Nothing. My wife decided we were going to quit. We quit.
There you go. That's what it is.
So then you're not afraid to go to the doctor anymore. You say, I've done something good for myself. You're not afraid to go to see your dentist anymore because I've done something good for myself.
So people who have bleeding issues,
Ooh.
who are smoking, or who've got tissue recession, damage to the gums, might have been nicotine caused or partly nicotine caused or what have you, and you brush your teeth, you got bleeding gums, you got sore gums, things like this, there's a point where you got to say, okay, time to get this into check.
Yeah.
Those are the people that the doctors at BC Perio can really help a great deal. We can really take somebody like that and turn your life around dramatically and stabilize the problems you have with your dental health and your gum health and such, and give you the opportunity to have your teeth the rest of your life.
So there's just about nobody that you cannot help.
Most people we can. We cover the vast majority of any surgical procedure you can imagine, with a save of cancer issues. We would generally offer to the oral surgeons. If it's a small lesion, we can probably take care of that without an issue, send it off for biopsy and clean it up. But mainly speaking, we'll probably, but everything else, just about everything else we can deal with.
So if you want to make an appointment with Dr. Ron Zokol, please feel free to give him a call, 604-872-0222. That's for the West Broadway location, 777 West Broadway at Willow, 604-872-0222. If you're in the Tri-Cities, it's in Coquitlam, 1175 Johnson Street at Glen Drive. The telephone number in Coquitlam, 604-936-8244. Oh, I always feel good after I talk to you.
Indeed, it's fun.
Can I just excuse myself? I want to go and brush my teeth. Do you mind?
I'll watch.
Okay, and I'll talk to you in about a month's time.
Sounds good.
Thanks for being here, Doctor.
Thank you.
Dr. Ron Zokol, and the address on the web, by the way, bcperio.ca, all sorts of wonderful things to learn, bcperio.ca. Give him a call Monday morning and ask for Dr. Ron Zokol, and he'll take good care of you. This is Tom Lucas on Boomer Life on CL 650. Smooth and easy. Thank you. Bye.